environmental factors have been considered, and that stems from the, I'm sorry, I'm pushing the wrong button, stems from the fact that in the early 80s, a chemical that was derived from drug processing in street drugs in California, actually on both coasts, was produced as a meperidine derivative. Basically, they tried to make a stimulant, and what happened is that they had a compound that was actually detrimental to the brain, and that compound went directly to their basal ganglia and caused damage such that they injected the drug into their veins for kicks, and they were within a week going into the hospital as 20 or 30-year-olds with Parkinson's. So that was very striking. And Dr. Langston, who's actually from Springfield, was critically important in this observation, because these groups of people that were doing these recreational drugs, they were being hospitalized on each side of the world, or each side of the continent, and the clinicians weren't speaking. This is before the internet and so forth. But what happened is at some meeting that the brains came together and they figured out that, yeah, maybe there's a common pathway. And then they figured out that there is this MPP+. Carbon monoxide also affects the basal ganglia, so people that have been exposed to this through accident or intentionally, they will damage their basal ganglia, the central part of the brain. And manganese, miners in parts of the world can develop Parkinson's disease. Cyanide poisoning also. So there are environmental factors that can damage the brain in our environment, but does not fully explain what's going on. So genetics has been considered and is really an intriguing area. And in the early 70s, there's been studies looking at twins, and that's really a really ripe area to look at genetics. But they really found that there was little concordance or little common between twins. Even looking at, there was higher concordance or commonality between monozygotic twins, which are those coming from the same egg. And then later in the mid-90s, there was a large Italian family that was discovered that had a gene on chromosome 4 that allowed for susceptibility to Parkinson's disease and essential tremor. Now, essential tremor is separate from Parkinson's, but it's worth mentioning now because it is commonly confused, particularly early on, but the key to essential tremor or familial tremor is that it is an action tremor, which means that it's different than Parkinson's tremor. It occurs when you're doing something. So it's very common. I'm sure any of you may know somebody who has intention tremor. And my laser light will show that I have an intention tremor, although it's not pathologic. We all have a little tremor, and that's okay. So they found out later that the alpha-synuclein gene was altered in this family, and it codes for a specific protein that is also found in Alzheimer's. So there may be a unique link there, and we'll talk a little bit about that. So we think that it's probably a mitochondrial disorder, and so we're digging deeper into the cell, finding out that there's some where the powerhouse of the cell is organized. There's some loss of function of that, and therefore the cell eventually dies. And there's probably some environmental as well as genetic factors that come to play there. If you look at Parkinson's brains, you can see, actually looking at the normal brain, you see the substantia nigra, which is where the dopamine is formed in the brainstem. Nice dark cellular structure that's doing the job, and you can see on the slides that they're packed with active cells. But in those with Parkinson's disease, these are faded away. They're dying off, and they're kind of few and far between. And then you have the Lewy body there. So in the genetic mechanisms of Parkinson's, we look at alpha-synuclein as probably the best worked out. And basically, a deficiency of this gene will cause the proteins that are basically waste products of the cell. They are usually organized if you have a normal genetic process and enzymatic process, but if you don't, then these protein strands become scattered, and they eventually form and cluster and clump together to form the Lewy body. So there's the cause of the Lewy body that for decades or century people were wondering what this was about. And there's other genes, the kinase gene, pink gene, and others that affect the mitochondria, and the mitochondria then fail and the cell dies. So we think that there's some link, and there's still some current studies going on. And so we consider Parkinson's disease more scientifically as a synucleopathy. Does anybody know this fellow? Co-founder of Google. You know Google, don't you? Well, he had enough money to get some testing done, and he found out that he has the LRRK2 gene, which is a kinase deficiency. And what to do with that? I think that's the key point now. What are we going to do? We have the ability to check for gene, but we don't know really yet what to do because there's no cure. He doesn't have the disease manifested yet. So it's really kind of a quandary what to do. One thing that has just come up in this year is the FDA approval for ioflupane, which is a dopamine transmitter uptake test with PET scanning. So it is available now since the early part of this year to determine those patients that are difficult to tell whether they have essential tremor or Parkinson's. And so what this demonstrates is that the dopamine transporter is normal in the striatum here in a person that doesn't have dopamine problems. But in Parkinson's, you can see how it becomes lost out on one side or the other. Therefore, the unilateral or one-sidedness of the disease. Well, I thought I'd share with you some clinical aspects of treating it. This was kind of the exciting frontier part of it, but you know, we have to work day to day. And so being a physician is not always as exciting as the first slides show, but a funny story is that, and I like this slide because one time I was driving Raymond to a soccer game or something, and he was talking to me when he was about 10 or something like that about what do I do as a doctor? And you know, I was asking him, and he says, well, I think all you do is just knock on people's knees and make decisions. So I like to include this slide. But in fact, we have to think about a lot of things. We have to be pharmacologists. We have to work with the pharmacologists. We have to talk to patients. We have to understand what their day-to-day problems are and empathize with what they're dealing with. They take a lot of medicines. They take them several hours apart. It's a big task for them and their caregiver. So listed here is a number of the medicines that we have patients on, and I'm not going to go into the mechanisms of those, but just to point out that the one that has been the most remarkable is carbidopa-levodopa, Sinemet, and that is the one where the movie Awakenings with, the comedian that Robin Williams played, yep, thanks. And it depicted in the early 70s the discovery of carbidopa-levodopa. It's a combined drug that requires carbidopa, but at the time that it was being initially administered, it was as levodopa, and it required huge amounts, so much so that it made people sick to their stomach and they'd throw it up. The carbidopa is an enzyme blocker that allows levodopa to get to the brain without being converted peripherally. And then we also use a lot of the dopamine agonists, which basically is replacing the dopamine that is lost in the brain. Okay, so these are things that we deal with every day. I just thought I'd show this, and that you know, frequently patients don't remember their medicines, and they describe them as I'm taking 3 of those little white pills. So I say, well, I don't know what that means, but anyway, so I like to show pills because that's, along with knocking on knees, this is the other thing I deal with.